Hello, this is Malachi Bishop. This is RC-750 Rehabilitation Counseling Research and Program Evaluation. And this is week 7. And this week we're talking about program evaluation. What, why, and how. So we are transitioning essentially from research into program evaluation. But what you will see in the next 2 weeks is that it's not that much of a transition. Program evaluation, you will see, is essentially an application, a specific kind of application of rehabilitation counseling research. So all the things that we've been talking about up to this point in terms of developing research questions and hypotheses, thinking about research process, thinking about sampling and identifying participants, thinking about collecting data, all these sorts of things are going to be applied in the process of conducting program evaluation. So this week in this section we will be talking about some basic questions and a basic introduction to the concept of program evaluation, the process of program evaluation. We will be defining what is program evaluation, why do we do it, and looking at the different types of program evaluation. So we'll start this week with the most fundamental question, which is, what is a program? If we're talking about program evaluation, we are talking about evaluating a program. What exactly are we talking about? And basically, a program is any set of related activities intended to achieve one or more objectives. So it can be an agency, it can be a program within an agency, it can be a federal, state agency, it can be a local, for-profit, non-profit, community-based rehabilitation counseling program. It can be a research program, it can be a grant, it can be health, hospital-based or other mental health and other sort of health setting based program. It can be a school-based program. It can be an ongoing program like the state federal vocational rehabilitation program, or it can be a time-limited program like a 1-year grant to run a project to see if we can improve, for example, employment outcomes among a specific group of people. It can be a project with one goal, and a lot of rehabilitation counseling programs just have one or very few goals, like employment, for example, or independent living, a lot of programs like that. And then it can also be many goals. So it can be an agency, or it can be a program that has a number of goals that are part of what the agency or program is committed to. As I said, it can be research-based, it can be a service-based program, it can be, you can see, just about anything as long as it is a set of related activities intended to achieve one or more objectives. So a program can be just about anything that meets that definition. What is a program evaluation? Program evaluation is targeted exploration or a systematic process of analysis applied in order to answer questions about a program, its goals, its processes, and its results. So what kind of questions does a program evaluation answer? I think it's helpful to consider 3 broad questions: the what question, the so what question, and the now what question. And I'd like to look at those individually, starting with what. Program evaluation helps us answer the question, what? What is the project designed to do? What are the intended outcomes of the project? And are those outcomes being achieved? Who cares? In other words, who's going to be affected by the program and its success or failure? And here we think about funders, agency funders, which could be, for example, taxpayers, administrators, certainly participants in the program, the agency that is operating the program, and the general public. So which group, who in particular, is going to be interested in the results, and how do the results, how does this program affect them? How is each group affected? What do we know about the program as evaluators? Sometimes it's a program that we are very closely associated with, like a program that we are working within, that we are maybe an employee of. And then sometimes rehabilitation counselors may be involved in evaluating programs that they have less knowledge about. What do we need to know about the project or the stakeholders in order to meet the evaluation goals? In terms of the so what, this refers to questions like, what do we do with the information that we collect in a program evaluation? Who is going to use it, and for what purpose? What kind of information will be most effective, and for whom? Which of those stakeholders are going to be using this information? And frequently, different stakeholders of the same program will be requiring or using different information in different ways. So what kind of information is going to be needed, and how will it be used, and therefore what is the most effective way to gather and present information? And then the methods. We have to consider how to go about doing the program evaluation. What will be the best approach? And we'll be talking about questions like, is a summative approach most appropriate, or a formative approach? An experimental or a survey-based approach to conducting and analyzing the results of the program evaluation. And then in terms of the now what, thinking about when we've finished with our program evaluation and we are presenting the information, how can the information be used to make changes, and what does this information mean for the program? So there are several purposes or reasons that we conduct program evaluation. Some of the reasons or purposes of conducting a program evaluation include, first of all, to demonstrate or evaluate accountability. And accountability refers to the idea of, is the program doing what it is supposed to do? Is it meeting the needs of the stakeholders? Is it achieving its goals? Is the program accountable to those that are being served by the program? And so questions like that are evaluated in a program evaluation. Another purpose of a program evaluation might be to improve the accountability or make the services better. You may be seeking to maintain or establish accreditation. So if you are working in an agency that is accredited, for example, by CARF or by some accrediting agency like CORE, for example, the Rehabilitation Counseling Program here at the University of Kentucky is accredited by the Council on Rehabilitation Education. And so in order to maintain our accreditation, every few years, we and all the other programs that are accredited by CORE have to conduct a program evaluation and present the results and show accountability to the accrediting agency and to all our stakeholders. And that's actually an ongoing process, something that we are thinking about all the time. Similarly, other rehabilitation counseling agencies that are accredited will at some point have to conduct a program evaluation to maintain or establish their accreditation. To identify problems is another reason why you may conduct a program evaluation, to identify things that need to be corrected, and then to identify the variables that affect outcome. So sometimes we are interested, for example, in better understanding why it is that some people have more positive rehabilitation outcomes and then some people have less positive rehabilitation counseling outcomes. And so we may conduct a program evaluation to explore the variables that impact outcomes so that we can improve outcomes for our participants, for our consumers, our clients. Other reasons for conducting program evaluations: to assess outcome or to understand and improve our services. Outcome evaluations, which are focused on evaluating outcomes, as it suggests, are increasingly being required by stakeholders and funders in public, private, nonprofit, and managed care programs. So there is much more of an emphasis currently than there has been in the past in general across rehabilitation and really healthcare agencies in being able to show that the program is effective and is addressing the needs of the participants and the expectations of the stakeholders. We look at questions like, is it working? And can it be working better? Is it worth the cost? Or do we need to consider a more cost-effective program? Keep in mind that without outcome research, programs are basically relying on guesswork or trial and error in service delivery. And what that means is without program evaluation, without every now and then stopping to consider whether what you are doing is the best way of doing it and whether you are meeting your goals, if you don't do that, if you don't take that perspective into account, then essentially you are just really relying on guesswork and hoping that what you are doing is the best way of doing things. Other reasons include to improve delivery mechanisms and to be more efficient and less costly, to verify that the program is doing what you think it is doing. And what I mean by that one is that sometimes programs are developed based on an idea, and then typically, I think this is more usual than not, plans about how to develop services end up changing, sometimes substantially, as the original idea is implemented over time. So program evaluation can assess whether the program is running and producing or meeting the goals that were originally planned, or if gone off track and we're currently doing things differently from how the program was originally conceived. And other reasons include to facilitate discussion and thought about the program's purpose, its goals, and how to meet them, and how you will know if the program has met its goals or not. So basically this is thinking about process and generating discussion and thought about the program and how or whether it is meeting the goals. Fifth reason is to produce data or verify results that can be used for promoting services or in the community or for public relations. So frequently a result of program evaluation is that the program has data that can show that it is meeting its goals, that it is being successful, and that information can be very useful in promoting services to potential participants or clients, and also for public relations. So it can be used to really promote the program or agency. 6, to evaluate programs within an organization, so as to compare them and determine need for change or elimination of programs. And this type of program evaluation frequently occurs in the face of tightening budgets, looking at programs within an organization to see if they can be combined, to see if some programs can be eliminated. So program evaluation can be used to identify the most effective programs and to make sure that programs that are not effective can either be revised or eliminated or combined. So that sometimes is a reason for conducting a program evaluation. And then the 7th reason, to fully examine and describe effective programs for duplication elsewhere. And that refers to the idea that sometimes an agency sees that a program is very effective at one site. So for example, some office in one part of the state is having very good success with a program that it has developed for working with employers. And you want to see if we can duplicate that success at another site somewhere else in the state. So you might want to fully understand exactly how this program is working. So you might do a program evaluation to examine and explore what it is that the program is doing, what it is that's making it effective, and then being able to replicate that program in another part of the state or somewhere else. I want to talk for a minute about evidence-based practice and program evaluation. And we've talked about evidence-based practice being the idea that healthcare professionals should provide their clients with the most effective clinical services based on sound research evidence. What does this have to do with program evaluation? Well, we are living in what has been described as an era of accountability. And this is true in rehabilitation counseling, certainly, but also more generally, just in the population. We are, in this age of the internet, we are all much more informed consumers than we used to be. So with sort of the onset of the internet, along with the changes in healthcare that had to do with managed care and the way that insurance companies were making decisions about services that they would pay for, we entered into this era of accountability where there are increased demands for productivity, demonstrated outcomes, and basically accountability of the program to the stakeholders and consumers. So as consumers ourselves of healthcare, for example, we have different relationships now than we did 30, 40 years ago with our physicians and other healthcare providers. We are more informed. We know more going in, and it's easier to get information even before we go and see a physician. We also have different expectations about the relationship that we will have with our physician. We expect to be provided with more information and more choices. So I think generally we all have higher expectations about the services that we receive, particularly the healthcare services, mental health, physical health, and so on, that we receive. This increased demand for accountability has certainly been seen in rehabilitation counseling. Going back to the Rehabilitation Act, 1973, you see, if you remember, that act actually had inherent within it a number of requirements for increased accountability and demonstration of outcomes. And since then, the Rehabilitation Act's amendments have continued and increased this expectation of accountability to consumers, clients, stakeholders. So in the state federal vocational rehabilitation program, and certainly in community rehabilitation programs, and really all the various agencies, services in which rehabilitation counselors work, there is this increased demand for accountability and showing that the services that we are providing are the most effective services, the most cost effective, and the most likely to help clients, consumers to be successful. So in this era of accountability, evidence-based practice is critically important. Evidence-based practice allows us to ensure that the services we are offering are the most effective. It also has some other implications. Chan and Chronister and Cardoza suggested recently that evidence-based practice has some important ethical implications as well. So they said the evidence-based practice movement underscores the importance of incorporating research-based knowledge into clinical rehabilitation counseling practice to ensure that people with chronic illnesses and disabilities receive the most effective services. They also suggested that evidence-based practice promotes ethical practice. So evidence-based practice helps rehabilitation counseling to provide more ethical practice by better protecting clients from harmful services. improving the efficiency of how scarce rehabilitation counseling resources are used, and then allowing people with chronic illnesses and disabilities the opportunity to exercise self-determination and informed choice, or autonomy, based on the provision of knowledge regarding rehabilitation services and care. So evidence-based practice, as I said when we talked about it earlier this semester, you're going to start seeing it, you're going to see more and more of it, and this idea is critically important in thinking about program evaluation. Let's talk about the different types of program evaluation. There are many. They can be, program evaluation can be goal or outcome based, process based, formative, summative, both formative and summative, or theory based. So we're going to talk about these individually. First one is outcome or goal based. This refers to programs that have been established to meet one or a few specific goals. Like a lot of rehabilitation counseling programs have one primary goal, for example, employment, independent living, things like that. So the focus will be on things like in rehabilitation counseling, the status of the program's progress toward achieving the goals, whether the goals are achieved according to the program plan. If they are not, then what are the changes that need to be made in order that the programs will be achieving the goals of the program? What changes need to be made to the program's plan, goals, processes, or personnel in order for that to happen? And if the program is meeting its outcomes or goals, objectives, then how can this progress, how can the effectiveness of the program be maintained in the future? So that's outcome or goal-based program evaluation. Process-based program evaluation, as you might expect, has more to do with how the program works. So it's designed to evaluate and understand the process, how a program works, how it produces the results that it does. So process-based evaluation can be very effective for programs that have been ongoing for some time. It's important every now and then, as we talked about earlier, to take a look and make sure that the way that the program is working, the processes involved in the operation of a program are still the most effective. So typically for long-standing programs that may have changed over the years or maybe have not changed, while the world around the program has changed in terms of the stakeholders, the perspectives of the stakeholders or customers, and problems are being observed for one reason or the other, then a process-based program evaluation can be very effective. Also for understanding a successful program so that it can be replicated elsewhere. Formative and summative program evaluation, important distinction to be aware of. So formative evaluation is a process of providing ongoing feedback concerning performance. The purposes are to identify aspects of performance that are successful or that should be improved, and to offer corrective suggestions while the program activities are forming or ongoing. Summative program evaluation, on the other hand, is basically at the end of the evaluation looking back. It is a method of judging the worth of a program or program component with respect to outcomes or goals. And as I said, generally at the end of the program, how well did this program do? It's also used intermittently. So let's say we have a 2-year grant to do a program. We might do a summative evaluation at year 1, for example. So we can make corrections, we can see how well we're doing, we can continue to do things successfully, but let's take a look and see if we're on track. So we'll do a summative evaluation at year 1 and then again at the end of year 2, for example. So basically summative is summing things up, and formative is as we get started or as we are moving toward our goal, how's this program doing? How effective are we as we are ongoing with this program? And then some types of program evaluation can be both summative and formative. And this is actually frequently the case, that program evaluation will occur during and then at the end of a program. And then, as with research generally, program evaluation can also be either in terms of quantitative or qualitative information, or both. Frequently, program evaluation will involve both quantitative and qualitative approaches, so both. And that will conclude the first section of our Week 7 discussion. And in the next session, we'll talk about planning and conducting the program evaluation.